Peds Patrol here, and before we consider avoiding vaccines, let's actually talk about the risks that are involved. So the video that you just saw previously talks about how MMR or MMRV vaccines can cause febrile seizures, and you shouldn't get the vaccines because of that. Let's critically appraise those articles which have been posted on very reputable journals. Now, keep in mind that these studies are cohort-based studies, which are based on populations. So specifically looking at Danish children, those who were not vaccinated and then got vaccinated, and what the risk of those who are vaccinated with MMRV, whether they got febrile seizures or not. And yes, there was a higher risk of them getting vaccine-related febrile seizures within approximately 1 week of getting the vaccines. This was approximately 1.5 times the amount. In addition, now getting the MMRV vaccine increases the risk of getting febrile seizures to about 5.8 times compared to getting the MMR vaccine and the varicella vaccine separately. If you hear that, then obviously any parent would be like, I don't want my child to get the vaccine because it causes febrile seizures. But really, it's a risk and it's not actually necessarily statistically significant or clinically significant. And that's where evidence-based medicine comes in, and speaking to your healthcare providers is really, really important to distinguish those things. So for example, did you know that any healthy child, vaccinated or unvaccinated, can have an increased risk of febrile seizures in general, 2 to 5%. In addition, another interesting fact about febrile seizures is that if there's a family history of febrile seizures, it can automatically increase your risk as well. Staying in the NICU, even going to daycare increases your risk of febrile seizures. Now, you can also say, you know what, I don't want the vaccine. I'm ready to have my child get measles or mumps or rubella and just face the consequences. However, there's febrile seizure risks with getting those infections too. Children who actually get infected with measles have about a 3% chance of getting febrile seizures. Children who have mumps can have an 18% chance of getting febrile seizures if they get contracted with that illness. So what does this mean for you as a parent? Well, if you're thinking about not getting vaccinated because of the risk of febrile seizures, the risk is there in any form, whether you get vaccinated or not vaccinated. So what this information is supposed to tell you, it's very important to be well informed about the risks. Ask your family doctor, pediatrician, or healthcare provider what those risks are and whether or not your child is potentially at a high risk of getting a febrile seizure and what to do if that ever happens so that you can make the most informed decision for your child.